You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
Continues to be a leader, not only in the Midwest, but across the nation, getting available shots in arms. And as of this weekend, we were once again #1 across the country in using our available supply. That means we're getting more of our doses in arms faster than any other state. So far, more than 2.7 million doses have been administered statewide, with more than 29% of Wisconsinites having received their first dose, and more than 50% of our folks over the age of 65 are fully vaccinated. And this weekend, we crossed a major milestone in our state with more than 1 million people fully vaccinated. Wisconsin, that's huge. We could fill Lambeau Field about 12 times over, and I couldn't be prouder of Wisconsinites. The community leaders, public health officials, healthcare providers, state employees, private partners, and businesses, and so many more who are getting this done. And while we still have a heck of a long way to go to get everybody vaccinated, every day we are closer than yesterday to getting back to our Wisconsin way of life. I know I've said it before, but folks, it's the truth. So far, we have had record days in distribution, including our single-day record last Wednesday of 73,114 vaccine doses administered in a single day, with more than a third of those shots completing a vaccine series, either with Moderna, Pfizer, or Johnson & Johnson. We continue to expand and grow our vaccine infrastructure with our next community vaccination site opening in Wausau next week. Now, I visited vaccine sites from Janesville to La Crosse to Green Bay, and our vaccine providers are as ready and eager to give shots as Wisconsinites are to get them. And the best news is that our supply continues to be steady. We're confident in our supply, we're confident in our vaccine providers, and we are confident in Wisconsinites. That's why I'm thrilled today to announce that we will be moving up eligibility to the general public starting on April 5th. That means starting next week, everyone over the age of 16 will be eligible for the vaccine. Now, it won't all happen at once, but I know I'm not alone in feeling the hope, excitement, and relief that we all have anxiously waited for this year. Wisconsinites should visit the DHS website at dhs.wi.gov to learn more about how and where you can get vaccines in your communities. Remember, supply is still limited, so please be patient and be kind to our vaccine providers. Believe me, they want to get you signed up and get shots in your arms just as much as you want to get them, and they are working tirelessly to do so. Everybody who wants the vaccine will get the vaccine. In the meantime, it's important to remember that there's more than hope and spring weather in the air. This pandemic is not over. Last week, we saw a rise in our 7-day average of new COVID-19 cases for the first time in 3 weeks. And in just the last 5 days, more than 2,000 Wisconsinites have tested positive for COVID-19. Also, just last week, we detected another new variant of the virus called P1 in the state. So, folks, don't give up now. Don't let the COVID-19 fatigue get the best of you when we are this close to the finish line. With eligibility opening up to all Wisconsinites next week, and especially with the holiday weekend upon us, we need folks to be as diligent as ever. Whether you're vaccinated or not, continue to wear your mask whenever you and wherever you go out. Practice social distancing, and remember outdoors with lots of fresh air is better than being indoors with others. Avoid gatherings with multiple households, and follow all CDC guidelines and recommendations. We can beat this virus, but we've got to do it together. Let's hang in there and let's get through this spring safely so that we can get back to Wisconsin as we know and love this summer. With that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dijk. Julie, it's all yours.
Well, thank you, Governor, and good afternoon, and thank you, everyone, for joining us. As the Governor just shared, we've reached over 1 million Wisconsin residents who have completed their vaccine series. To be exact, 1,013,613 residents have completed their series. We have administered 2,753,146 doses as of today. 75% of our friends and neighbors aged 65 and older have received at least one shot, and well over half of them have completed their series. We're making significant progress in our vaccination efforts. Over 345,000 doses administered last week alone, setting a new record for the 7th consecutive week. and over 1 million Wisconsinites have completed the series since mid-December. These are all impressive numbers, and they are only possible because of the hard work and dedication of our vaccinators across the state, our healthcare providers, our local and tribal health departments, our pharmacy partners, and our community-based clinics. At the start of vaccinations, I called the effort to vaccinate the residents of Wisconsin the most significant public health intervention of our lifetimes. It has been and will continue to be a monumental task, and our vaccinators are up to the challenge. Again, thank you. We continue to add vaccine providers to our network, including more pharmacies to the Federal Pharmacy Partnership Program, including CVS, Hy-Vee, and Costco, as well as many other smaller chains. With more and more locations available to Wisconsinites who are currently eligible, we are continuing to build on our progress and strengthen our effort. One place we've seen significant success as a state is the percentage of our vaccine recipients who complete their series. Remember, for the Johnson & Johnson vaccine, one shot is a completed series, but Moderna and Pfizer both require a second dose for the series to be complete. Wisconsin is a leader in the country in completed series, and that's something to celebrate because a completed series means more effective protection. So let's keep that trend going. And just as a reminder, remember to schedule your second dose right after you receive your first. And if you miss that appointment, call your vaccine provider and set up another one. Yes, we want you to get that second shot on the right day, but at the same time, we want you to make sure you get it. And we need to continue to all do our part, as the governor said, to stop the spread. Spring brings a lot of holidays along with it, holidays that in typical years might involve travel or gathering with family for special meals and traditions, or all of the above. We need to remember that this is not a typical year. I know it's not the message we want to hear, but traveling is still not a safe activity. And gathering for a meal inside should only happen if everyone at the table is fully vaccinated. Keep washing your hands well, keep physically distancing, keep limiting your interactions, and keep wearing a mask when you're out, even if you are fully vaccinated. We need to continue taking these actions that stop the spread precisely because COVID-19 is still very present in our state. We are adding 588 confirmed cases of COVID-19 today, which brings our total to 576,632 people. As the governor said, our 7-day average is increasing, and it is now at 501 cases. We are reporting 11 more deaths, which brings our total number of lives lost to COVID-19 to 6,612 people here in Wisconsin. As we hold these families and loved ones in our hearts, let this be a reminder that we all need to do our part to stop the spread. And as the governor said, stopping the spread is even more important today because last Friday we announced a third variant strain, the P1, which has been identified in our state. With confirmation that all three variants are present in Wisconsin, we must increase our efforts to stop the spread by masking up and getting vaccinated as soon as possible, not only to protect ourselves, but to protect our loved ones, our friends, and our coworkers from infection. We have a window of opportunity to prevent further surges and even more potentially dangerous variants. So mask up and get vaccinated, Wisconsin. And with that, I'll turn it back to Jennifer, and we look forward to your questions.
Thank you. And a reminder to maintain audio quality. Please keep phones on mute until it is time to ask your question. We need to be finished by 2:30, so in the interest of time, please, only one question per reporter. And we'll begin this afternoon with Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding the today Assembly Republicans called for prioritizing some of the stimulus funding coming to the state for nursing homes, saying they hadn't received enough. Governor Evers, can you talk a little bit about what your priorities are for nursing homes with this $3.2 billion coming to the state? Thank you.
Sure, and I'll also talk about in terms of my budget. We've put significant increases for nursing homes all across the state of Wisconsin, historic highs, and so that is obviously a top priority for me, and that includes focusing too on pay for the folks that work in our nursing homes. It's really complex, difficult work, and whatever I can do as governor and through our budget, we're working to make that happen, is to have higher pay for people there. It makes it easier to recruit, but also it's fair for the people that work there. Second of all, in the America Recovery Act plan, we will also be prioritizing nursing homes, especially as it relates to the things that they need in order to maintain a safe environment. It's the issues around PPE and testing and anything else that goes along with making sure that we keep the virus out of our nursing homes. So we believe that with the budget and with our opportunities with the American Recovery Act, that we will be in a good position to continue to support our nursing homes just like we have throughout this pandemic.
Thank you, Sean. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah. Thank you very much for the time today. A question for the governor regarding the state mask order. Obviously, the Supreme Court plans on making a decision on that tomorrow. So it's kind of a two-part question. One is if that is struck, or if they do rule against that order, would there be any response on your end to that? And then on the flip side, if they rule in your favor, I was wondering if you've decided if you might be planning on extending that order, which I think is set to expire on the 5th. Thank you.
We'll be observing their response with great interest. I'm hopeful that we will win that case, and if so, at that time we'll decide whether we're going to extend that order or not. I've always said, and I know that the scientists that are part of our world, we have to be in a downward trend, and also we have these new variants that are more they're stronger in their transmission. So would we possibly extend the order? Possibly, but we'll make that decision on the 5th.
Thank you, Mitchell. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks again for taking the call. Moving up the eligibility for all Wisconsinites 16 and older to April 5th, what are some of the factors that allowed that decision to move that eligibility forward? Thanks.
There's several things that helped us make that decision. First of all, as we've talked about over the last few weeks, the federal government has been able to give us more and more reliable estimates of how much vaccine will be coming into the state for longer and longer periods of time. And so we feel very confident that the predictions they're making about additional doses of vaccine have held true throughout the month of March and will hold true in the month of April. And so with more vaccine coming into the state, we want to be sure that there are more and more eligible people to receive those vaccines. Secondly, we've made really great progress on prior phases, as you've heard. We've vaccinated the majority of educators in our state, or they're in the process of completing their vaccine series. As you've heard, we've made amazing progress with people over age 65. And we know a number of the other populations that were in the 1B population that began March 1st are also being vaccinated. And with putting people in the group 1C with chronic health conditions forward or last week, we've given those folks a head start ahead of the general population. But we also know there just aren't that many more people left to put in the mix. And so this decision to move ahead with everybody really simplifies the whole scenario for our vaccinators, for our public. No more having to sort out if you're in or if you're out. It's time to just move forward and get everybody with a shot in their arm.
Thank you, Casey. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, I'm just wondering if you think that 2 weeks was enough of a head start for those with chronic conditions. I mean, that group was more than 2 million people.
Yeah, I think many of our healthcare providers have been reaching out to people, have been scheduling appointments. I know myself, I got a notice from my healthcare provider and with appointments available through the month of April. So those folks have largely been making appointments. The other thing is opening it up to everybody doesn't mean that providers can't continue to prioritize people with chronic conditions. And so especially in our healthcare system where they have relationships with these patients and they have data about these patients, I fully expect that healthcare providers will continue to prioritize people with chronic conditions first. And that's the beauty of our system here in Wisconsin. We have many doses going to healthcare. We have doses from the federal government going to pharmacies that can be disseminated more generally throughout the population. And so there's a system for everybody here.
Thank you, Stephanie. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, you've mentioned that Wisconsin leads the nation in being one of the most efficient vaccinators. Just what, in your opinion, is Wisconsin doing so well to put us ahead of all of the other states? Thank you.
Well, it's very much what I was just referencing is the number of different avenues we have for people to get vaccinated. In a number of other states were more, you might say, more methodical in the beginning about a smaller number of vaccinators having vaccine for the smaller number of people who were eligible for vaccine. In Wisconsin, from the very beginning, we said we want many vaccinators in our queue. And we have largely been able to provide most of those vaccinators who asked for vaccine at least some vaccine over the last 3 months. So whether you're a small pharmacy in Hayward, Wisconsin, or the Aurora healthcare system, we have been providing vaccine to you throughout this whole 3 months. So people are not getting in tight little pipelines to get to vaccine. They have the opportunity to search throughout a number of different vaccinators and find people with available vaccine. I mean, the downside of that has been some of the frustration you've heard from folks about there's too many places to look. But I think our results show that this method of having many different providers providing vaccine and including larger community-based clinics that have been stepping up and serving lots of people in their communities have been a great combination that the proof is in the results that we are getting vaccine moved through this state very quickly.
Thank you, Madeline. Now to Jonathan Sadowski from Up North News. Jonathan.
Hi, thank you for taking my question. What effect does this announcement today have on the projection for herd immunity in the state? I think where we last left it was around end of June. Is it still about that, or are we thinking a little earlier now?
No, that projection was made based on our projections around supply. And so based on the information that the federal government has given us, that would still be about the time that we would anticipate sometime in June that there would be adequate vaccine supply in the state to have achieved that level of herd immunity. So as we've said all along, in order to get there, we need supply, we need vaccinators, and we need people willing to accept the vaccine. For the first few months, we kept saying supply's the issue. We don't have enough supply to get there. I mean, the supply will be building through April, May, and June. But now, and we clearly have the vaccinators, as we've shown, with our effectiveness at getting vaccine into arms. And now we continue to need Wisconsinites throughout the state to keep raising their hand and saying, I'm ready for my vaccine. And everyone expressing willingness to be part of the solution here and get us to that 80% community immunity.
Thank you, Jonathan. Now to Brittany Schmidt from WBAY TV in Green Bay. Brittany. Once again, Brittany Schmidt from WBAY.
Hi, sorry, I had trouble unmuting. I just have a question about, you talked about some places will still be able to prioritize because we still have individuals here in Northeast Wisconsin, the rural areas, who are 65 and older, still waiting to get that vaccine. So adding this rest of the group of people, does that kind of put them on the back burner? And then my second question is, you talked about an increase in doses. I know that we are waiting for more Johnson & Johnson towards the end of March. We were expecting to get that. Is that where this increase comes in? Because we're getting more and more Johnson & Johnson vaccines, so we're able to up eligibility?
Yep. So again, if there are people 65 and older who are still waiting to get vaccinated, I encourage them to contact their healthcare provider and to make sure they know their age. They will get at the front of the line. Everybody knows that is our most at-risk population, and we will continue to move through those folks. And I don't think there's a 25 or 35-year-old in the state who wouldn't say, to a person who's their elder to go ahead and get vaccinated. So we'll continue to work on that throughout the state. And as we've said, we know it's not even everywhere, but we will continue to work on that. And yes, a good part of the increasing supply has both been a steady increase in both Moderna and Pfizer vaccine. The federal government predicts we'll continue to see a little bit of an increase in Moderna and Pfizer, but we're getting close to reaching their manufacturing peaks. But most of the increase will come in Johnson & Johnson vaccine. So just to give you a summary, when the Johnson & Johnson vaccine was first authorized, we received 48,000 doses of the vaccine. And then in the middle weeks of March, we only got about 6,000 doses a week. Last week, we received 34,000 doses of Johnson & Johnson, and we expect to continue to see regular increases in that amount in the month of April.
Thank you, Brittany. Now to Gabby Bachara from News 3 Now in Madison. Gabby.
Hi, my question is, we've seen a lot of success online with the walk-in clinics near Milwaukee. Is there any plans for the state to have some of those in Dane County in the Madison area?
So I want to be really clear that those clinics have been under the leadership and supervision of the City of Milwaukee Health Department, because vaccination in our state, the actual act of doing vaccination in a local community, is largely a local effort. So first of all, big shout out to the City of Milwaukee Health Department and the incredible work they're doing. They've done some of that work with those walk-in clinics in North and South Division High School in collaboration with the Wisconsin National Guard and our mobile vaccination teams. And that's exactly the role of the state, which is to step in and assist local communities when they ask for that kind of support. But as we stand up large vaccination sites across the state and provide that additional support, either through FEMA, as has happened in Milwaukee and will be happening in Eau Claire soon, or through our state AMI vaccination sites, what we're doing is encouraging local health departments and their partners to do that kind of targeted vaccine for populations in their community that may have barriers to getting either to their healthcare provider or those mass vaccination sites. So places that might have a lot more questions about the vaccine or places where people may be disabled or have mobility issues that make it harder to leave their home and get vaccine. And I know here in Dane County, Public Health Madison Dane County is exploring a number of different opportunities for reaching out, for example, to shelters and to other community organizations. And I know a number of our federally qualified health centers and free clinics are doing that kind of work. And in other parts of the state, local EMS, I know in Milwaukee County, EMS is getting ready to do a program where they will use additional vaccine to go and vaccinate homebound people. So, our first push has been on getting large groups of people vaccinated very quickly. This middle push will be to continue that, but to also start to look at how we reach populations, and particularly those who have faced disadvantage and have not been at the front of the line, to make sure that we're providing equal access across our state.
Thank you, Gabby. Now to Todd Richmond from the Associated Press. Todd?
Hi there. The governor several times has said that we need to be vigilant because we're so close to the finish line. How do you define the finish line, and is there even ever going to be one? Is that sort of like saying there's a finish line for measles or mumps? I mean, the chances of eradicating this disease are nil. So how are you defining the finish line?
Well, we know it's not tomorrow, Todd. So I would start out by saying that until we get some level of herd immunity, we're not even close to the finish line. And, we've been doing this for a year now. And so there's no, frankly, I think saying, well, it's going to be August 15th and about at 3:30 in the afternoon. That probably won't happen. But we will know when we're close to the finish line by the amount of transmission that we're seeing in the state of Wisconsin. Right now, we have a lot of it. I could be wrong, but Julie can correct me, but I think the number of cases that we have now is comparable to the number of cases that we had last October. And it wasn't too much after that we frankly, all hell broke loose in the state of Wisconsin, and we had significant increases in the number of cases. So to say where the finish line is, it's frankly easier to say where it isn't. And it ain't right now, and it won't be until we see a consistent decrease in the number of cases and a significant number of people in Wisconsin getting shots in the arm.
Thank you, Todd. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking this question. In light of the increases that you have noted over the last now up to a couple weeks, are we in fact in a surge or on the cusp of one? And is there something different in the current numbers in terms of demographics or the severity or other aspects versus previous periods when we've had increases? Thank you.
Well, Eric, one of the challenges of a surge is it's always easier to know when you were in a surge after it's happened than when you're in the midst of it. So are there warning signs of a surge here in Wisconsin and across the nation? Yes. There is a growing number of average cases per day is a warning sign. The CDC director, had some strong words earlier today or yesterday about what she is observing across the nation. And so that is why we know what we can do about it, and we're asking people to do that, which is to continue to take the preventive measures that we've been taking and to not act like this is all over. And as Governor Evers said, step up and get vaccinated so that there's not an open vaccine appointment anywhere in the state between now and the end of June. That is what we need to do to continue to fight against this disease. We don't see any significant trends like we did in the fall of a significant increase in any given age population right now. We continue to monitor disease spread across the state and in different geographies. And I think one of the things we can take some solace in right now is that our death rate remains low, although remember, death is a lagging indicator. We wouldn't be seeing deaths yet from this increase we've seen over the last 7 to 10 days, because that follows several weeks after an increase in cases. But we have seen a significant reduction in cases and deaths in our long-term care facilities. And I think that is encouraging, because that says to us the vaccine, which was delivered there first to many, many residents, over 80% of residents received that vaccine, the vaccine is holding. So, and protecting our most vulnerable. So we need to do what we keep saying we need to do in order to make sure we don't see some new demographic trend or some way for this virus to mutate and become more deadly, for example, in younger people. And we just implore our Wisconsin colleagues and friends to hang tight, keep your social circles small, keep your mask on, and get a vaccine. I forgot Traci DeSalvo's with us, but Traci, anything you would say about the trends we're seeing?
No, nothing additional, Julie. Thank you.
Thank you. And now to Katrina Nickel from Fox 11 in Green Bay. Katrina? Katrina Nickel? Okay, we have to move on then to Nick Bohr from WISN TV in Milwaukee. Nick? WISN? And a reminder, *6 unmutes your phone. Okay, let's move on then to Heather Poltrock from WSAW in Wausau. Heather?
Yeah, this is Tony filling in for Heather. We're wondering, can vaccinated people still act as a carrier for COVID and spread it to non-vaccinated people? Thank you.
I'm going to turn to Traci DeSalvo for the answer to that question.
Thanks very much, Julie. So there is still ongoing research, and that's one of the reasons that we are really asking people, even people who are vaccinated, to continue to maintain that small social circle, limit your contact with unvaccinated people, and continue to wear masks and practice good physical distancing. And that's really part of the change that you saw with the CDC recommendations a few weeks ago to allow vaccinated people maybe to get together in small groups. They do still really recommend caution when you are getting together with unvaccinated individuals because of that.
Okay, thank you. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you for the question or availability for a question today. Wanted to talk about the point where vaccine availability exceeds those clamoring to get it. Do you have a sense of what type of gap we're likely to face to get to that herd immunity, and what will the state do to encourage those who are sitting on the fence?
Well, it's hard to measure that, and we will. It's kind of like the surge question. We'll know it better when we get there. What we've seen from national studies is that that have been done periodically from last fall until now, is that more and more people are indicating they are interested in getting the vaccine. I think this has been supported by the fact that millions and millions of people in the United States have received this vaccine, and it has been demonstrated to be very, very safe. And that provides a lot of people who were just a little uncomfortable about a vaccine that had been developed in a relatively short period of time more comfort seeing their fellow Americans safely receive this vaccine. So I think one of the biggest things that helps us is the safety profile of millions of people getting the vaccine. But clearly, the other thing that helps people is hearing about the vaccine from people that they really trust. And so part of our plan is to continue to reach out and encourage local messengers to tell the story about vaccine safety. People like to hear this from their own doctor or healthcare provider. And so we know our healthcare community is a really essential messenger in this. People like to hear this from their family members. They want to know, yeah, mom and dad did okay with it, so the kids should be okay with it. They want to hear it from their coworkers. We've seen this in our nursing homes that when we went back each subsequent time for second doses, that more and more both residents of the nursing home and staff of the nursing home raised their hand and said, now I'm ready and willing. And frankly, I think this issue of the variants and the prevailing picture that we're still going to have COVID-19 could motivate some people to say, well, I was hoping it would go away by now, but it's not, so maybe it would help if a few more of us got vaccinated. We'll be doing some mass media campaigns, and we're also providing grants to a number of local organizations that will be reaching out to members and in neighborhoods to spread the news about the vaccines, the safety of the vaccine, where you can get the vaccine. And it's all of these things together that I think will help provide the information that people who might be a little bit more hesitant need in order to make a good decision.
Thank you, Jonathan. Now to Mary Pouch from WQOW-TV in Eau Claire. Mary? Reminder, *6 to unmute your phone. Mary Pouch from WQOW in Eau Claire. Okay, moving on then to Allison Bruner from Spectrum News. Allison.
Thank you for taking our questions. You kind of elaborate on this, but if you could just please share a message to all the Wisconsinites who are experiencing vaccine hesitancy, especially those COVID-19 long haulers.
Yeah, I think what I would say to folks is if we want to return to a life that we knew before COVID, the more of us who get vaccinated, the better off we will be. And it really is, a vaccine is not just about protecting yourself, it's about protecting those around you. And so just like we came together and wore masks, and that helped bring the rate of COVID down, we need to come together and take the vaccine, and that will bring the rate down. Those who are COVID long haulers, which I think is typically defined as people who had COVID and are continuing to experience symptoms from the vaccine, from the infection, it's possible this vaccine could assist with your symptoms, but what we do know is it will prevent any kind of reinfection. And certainly if you're experiencing symptoms from COVID-19 in the long haul, you don't want another infection from that. So, and again, I encourage anyone who has hesitation about the vaccine to get online, to go to reliable sites like the CDC or the American Academy of Pediatrics or Family Practice or the National Institutes of Health and read about the vaccine. And then talk to your healthcare provider, talk to your family, and make a well-informed decision for yourself.
Thank you, Allison. Now to Elise Romas from NBC 15 in Madison. Elise?
Hi, thanks, guys. Just had a quick question about the extension of that federal pharmacy program. Some of the pharmacies that I talked to, there was some confusion because some of these independent pharmacies already get their supply through the state. So now that they have been added to this federal program, they can't go from both and double dip on that distribution. So just wondering, how that works now, if they're carrying over to the federal program and not doing the state program to ask for vaccines. I just wondered if you could clarify that for me.
You bet. So it actually isn't that they can't do both programs, but what I understand is there's different record keeping for both programs. So most small pharmacies don't want to be doing record keeping in two different programs. So we're encouraging pharmacies who are part of the federal program, receive your vaccine through the federal program, and then we'll take that state vaccine and give it to other vaccinators across the state and increase the wealth across all of our vaccinators. So it is a situation we're working out the cadence with the federal government, and hopefully we'll be in a situation where we'll know when we're making our allocations who they're giving their vaccine to. We hit that after a week or two with new vaccines in the program, or new pharmacies in the program. But I think that's the situation for those receiving vaccine directly from the federal government. It's just a matter of there's different data requirements, and it's just easier to stick with one program versus two. And we're all in this together, so it provides an opportunity for then that vaccine to be distributed to others.
Thank you, Elise. Now to Francisco Almanara from WKOW TV in Madison. Francisco.
Hi, can you hear me okay? Okay, my quick question is, with supply still limited, as you said, and opening it up to so many people next week, what are some ways that the state is making sure that you guys make the best use of the supply available? And would you entertain delaying the second dose to get more people the first dose after seeing the CDC results from their research yesterday showing the effectiveness of just one dose?
Well, going to your first question, there's a number of things we're doing to make most effective the doses that we have. We are moving to a place where we're guaranteeing our community vaccination sites a certain amount of supply each week. We're working towards guaranteeing a number of our health departments and hospital systems a certain amount of supply each week. So as we've gotten more and more doses, trying to set a floor, at least. It's often not a floor high enough for some of them, but a floor of dependable vaccine supply so people can plan accordingly. So that's one thing to help and to maximize that vaccine supply. In terms of delaying the second dose, you heard earlier, we are one of the top states in the nation with completing the vaccine series. And currently, this vaccine is authorized under an emergency use authorization from the FDA, and that emergency use authorization specifies a 2-dose series. And so we will not vacillate from that unless the FDA modifies its emergency use authorization or will be in violation of the conditions under which we receive the vaccine. I think with what we're doing here and the rapid speed we're making with vaccination, we're doing pretty well that we'll get vaccines in arms quickly. But if different determinations are made by the scientists at the national level, we'll certainly follow their guidance.
Thank you, Francisco. Now to Stephanie Haynes from TMJ4 in Milwaukee. Stephanie.
Hi there. My question is, do 16 and 17-year-olds need permission to get a vaccine? And then, so in that case, can parents deny permission? And then in that case, what do you do about a 16 or 17-year-old who wants a vaccine, but their parent isn't giving permission? Thank you.
Well, 16 and 17-year-olds do need parental consent to get a vaccine. In terms of what the legal options are beyond that, that's not in my wheelhouse.
Thank you, Stephanie. Now to Drake Bentley from the Milwaukee Journal-Sentinel. Drake?
Hi, thanks for doing this. When you talk about the hesitancy issue, was that a factor that went into the decision to move up eligibility?
It was not.
Thank you, Drake. Now to Brittany Slaughter from WAOW TV in Wausau. Brittany?
Thank you. So my question is, and you talked about this a bit with trying to make the vaccine eligible to more groups, and
we've got groups here in central Wisconsin trying to bridge a gap. They say that the Hmong's population is way down in getting their vaccines because of language or technology barriers. So kind of what is the DHS doing to specifically help minority or non-English speaking populations in the state? Thank you.
Yeah, I think that's a great example. So for example, one of the things that we're doing is citing a community vaccination site in Wausau in Marathon County next week. And that frees the local health department from having to run that kind of site and being available to work with partners to do more targeted outreach to the Hmong community and that community. And I know there are plans underway looking at ways to do outreach to our Hmong American friends in that community. In addition, we're working very hard on making sure that the registration site, the Wisconsin COVID vaccine registry, is available in a variety of languages. Currently, the website is available in English and in Spanish. We will be expanding that to Somali and Hmong soon. But in the meantime, the COVID hotline associated with that website has language availability in Hmong, in Somali, in Chinese, in a number of other languages, and those are listed on the homepage for the registry. So people, if they can get to the homepage, can see that number and ask for assistance in their own language. And that is where, in this next phase of vaccine rollout, I think we'll be doing, both big clinics, as I said, and then smaller targeted efforts, very similar to the kind of work that has been announced in the city of Milwaukee, going into neighborhoods, going into community centers, going in your example, where Hmong people gather together and offering the vaccine at those sites. All of these will be very effective strategies moving forward. And it's another reason we wanted to make the vaccine available to everyone, because another barrier I've heard for many populations, especially those with limited English, is just trying to sort out who's in and who's out. And we thought, let's remove that barrier now that we're at a point of more steady vaccine supply, and just let the message be, you are all welcome to come get vaccine.
Thank you, Brittany. Now to Rich Kramer from Wisconsin Public Radio. Rich.
Hi, thanks for doing this. Mayo Clinic Health System hospitals in Western Wisconsin are basically only administering shots to the people with underlying health conditions that are 45 and older. Are you aware of other hospital systems still kind of holding back from what the state eligibility requirements are? And is there anything the state can do to try to help them get more shots in arms?
So I would say Mayo Clinic is doing exactly what we want Mayo Clinic to do. They are prioritizing people with chronic health conditions. It sounds from your report like they are doing that based on age. So they're taking the combination of older patients with chronic health conditions and moving down. If they're down to 45, they've made quite a bit of progress in a week from people who are 64 down to 45. So they are doing exactly what we would want them to do. That is a perfect role for healthcare systems in this rollout. The eligibility does not have to be applied equally across every other provider. At a community-based vaccination clinic, it's harder to know who has a chronic condition and who doesn't. So there's, an open place that others in that community can go to get vaccinated. Similarly with pharmacies, people without chronic conditions or younger people with chronic conditions whose number may not have come up in their health system yet can go to pharmacies, can go to Walgreens, can go to Costco, can go to Walmart and get a vaccine. So it's that combination of different entry points for different people with different conditions that I think is what is making our system very successful. And that is exactly what we want our healthcare providers to continue to do.
Thank you, Rich. Now to Jonah Chester from WORT Radio in Madison. Jonah?
Hi there. Thank you so much for taking my question. Would you all be able to provide us with an update on immunization efforts amongst Wisconsin's incarcerated individuals? They've been eligible for nearly a month now. Do you all have rough numbers for how many of them have been fully immunized or received at least one dose of the vaccine?
Yeah, I know our colleagues in the Department of Corrections have been focusing largely on people with chronic conditions. Well, people, first of all, over 65 who have been in their care, and people with chronic conditions, and are now moving into thinking about vaccination for the general population. I do not have exact numbers of how many have been vaccinated at this point in time.
Thank you, Jonah. Now to Emily Fannin from CBS 58 in Milwaukee. Emily?
Hi there. Thanks for doing the call today. This question is for the governor. President Biden has pleaded with some states to not rush reopening plans and to keep restrictions in place like the mask mandate. Did you speak with him or any of his aides about this? And does this mean that you will likely issue a new mask order this week, depending, of course, what happens in the state Supreme Court?
Well, yeah, there's a lot of moving parts in a short period of time. We have the Supreme Court making a decision. And as I said before, we're monitoring case levels and whether that slope is down or up. And so there's a lot of moving parts. If I have the authority to make that decision, and it looks like we do need to extend the mask mandate, we will do that. But at the end of the day, we'll be making that decision at sometime in the very, very near future. But I agree with the president. Having a mask mandate is the surest way to make sure that we're in a position to beat this virus. And if indeed at some level we're struggling with a Supreme Court decision, as we have in the past, I will certainly be encouraging people across the state, as will our local public health officers, to make sure that people understand how important it is to keep on keeping on as it refers to wearing a mask.
Thank you, Emily. And we have a few minutes left, so we'll go back to some people that we've called on earlier who weren't available, beginning with Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. Thank you. Sorry about that. My question is, obviously with the state making more people eligible for the vaccine next week, some Northeast Wisconsin vaccinators like Bell and Health and the Fox Cities COVID-19 vaccination clinics say they still aren't getting enough vaccine supply to handle the increase of eligible people. I was wondering if you could elaborate on more about the supply increase we'll be seeing. You elaborated on Johnson & Johnson, but could you explain a little bit more about what increases we may be seeing from Pfizer and Moderna, and a specific number on what the state is allocating these next few weeks? Thank you.
Yes, so we'll be seeing a small increase from Pfizer and Moderna, probably in the neighborhood of 10 to 20,000 doses. We'll be seeing increases from Johnson & Johnson. I don't know the exact amount, but I'm thinking more in the range of 35,000 to 70,000 doses. But we will see, the federal government gives us ranges, and we will see how those predictions come true and that would be over the months of April and May. I know there is almost no provider in the state who gets as much vaccine as they want. And I know everyone would like to have 20,000 doses so they could do everybody who's calling their clinic right now. But we will get through this over the next few months. Remember, we have 1 million people already done and out of the queue. They are finished. We have another 1.7 million who only need one more dose. And so we have a lot. We will start to have fewer people in line because they are complete. And so our vaccinators and our people waiting to be vaccinated, there are doses coming. You will get vaccinated. It may not be next week, just like when we open any new phase. We will continue to vaccinate through the months of April and May. The supply didn't really change that much in terms of making this decision. It was the steadiness of the supply that has changed, and it was removing the barrier of trying to decide who's in and out that is really the core of this decision. It's still going to take us some time, folks, but we will get there.
Thank you, Katrina. And that will conclude today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.